Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Do you have a snorer at your house? Somebody that could wake the dead almost, except they don't wake themselves up? Well, oftentimes if our children are snoring a lot, they're probably not sleeping well. And many times they'll be making this horrible noise and then there'll be a pause in between, and that's kind of scary. That's called apnea. Well, if your child is snoring a lot or snoring or breathing irregularly, it's important to check with your doctor. Could there be something that you should do something about? It could mean they aren't getting the rest they need, and so it can affect behaviors later on. The important thing that an article out of JAMA showed us was that sometimes snoring is improved if, get this, we use saline. You know, we've talked about the saline with the little kids to keep the secretions thin so that maybe they won't have as much coughing. Well, saline, it seems, may help snoring in children that are a little bit older. This study was looked at 3-year-olds on up, and they found that if they used it regularly, at least once a day, didn't say exactly what time, but at least once a day, many of the snorers did a lot better and didn't have to go to have their tonsils out or other evaluation. Now, if your child is snoring, we do want you to go see your doctor. Don't just automatically use the saline and say that's going to take care of it, because you don't want to miss some of the other issues that are there. But keep in mind that if you can teach your children to use the saline, that may help with the other secretion sinus stuff that we've talked about before, and now maybe it'll help with the snoring. So be sure and check out what your child is doing so they're getting enough rest, sleeping well. You don't want to miss something along those lines. But see if you can get them to use a little saline and give that kid a hug.